Hey, so this is a review of the Sensodyne Rapid Relief toothpaste. Most important question is, does it desensitize your teeth? Yes, it can, because the Sensodyne Rapid Relief toothpaste desensitizes teeth by occluding exposed dentinal tubules. What I mean by that is, a lot of times when you start getting gum recession, it exposes these dentinal tubules. Okay, so where these dentinal tubules lead is that it leads directly to the nerve. So if you're drinking something cold, something hot, right, it can kind of stimulate the nerve directly. Okay, under normal circumstances, the gums are covering this, so this is not exposed, so you don't get that sensitivity when you drink something extremely cold. So what this toothpaste does is that it contains stannous fluoride. Okay, the stannous fluoride here, if you look on the purposes, it says anti-hypersensitivity. So what that does is it actually occludes or blocks these exposed tubules. So here you have like here's just a demonstration where you see like the open tubules, and after you brush with the toothpaste, you'll get the tubules are now clogged or closed. Okay, so what that does is it prevents the nerve from being stimulated on the tooth, and that's how it basically blocks a sensitivity. Okay, so the next question is, does it actually provide rapid relief? Because this toothpaste is marketing itself as a rapid relief toothpaste, where it relieves sensitivity almost near instantaneously. The best way to kind of explain this is that we should do like an apple to apple comparison, where we compare it to other Sensodyne toothpastes. Okay, here we have some Sensodyne Pro Enamel toothpastes. Okay, the gentle whitening, the fresh breath, and also the daily protection. Okay, so these are all sensitive toothpastes. Where you see sensitive, sensitive, and sensitive. So how these toothpastes desensitize your teeth is by using potassium nitrate. Okay, potassium nitrate, anti-hypersensitivity. Potassium nitrate, anti-hypersensitivity. And the same thing for this one too. If you look right there, right, all using potassium nitrate. So these traditional sensitive toothpastes, which use potassium nitrate, it takes about like 2 weeks for you to start seeing the results, where you actually experience a decrease in teeth sensitivity, and then that result kind of builds up to about 16 weeks before you get the full desensitizing effect. The reason is that when you brush with the potassium nitrate, it takes a while for it to kind of work its way through these tubules and into the nerve, where it actually depolarizes the nerve, or it desensitizes it. So it takes anywhere from 2 to 16 weeks, with 16 weeks being the full time frame where you see the full desensitizing effect. The rapid relief toothpaste, on the other hand, right, it uses stannous fluoride, which blocks the tubules. Okay, because it has a blocking effect, it doesn't need to travel through to the nerve. It could just kind of stay at the opening or the orifice and just kind of block it. All right, so it just blocks it at the entrance, and it doesn't have to block the entire thing. Okay, because it just works on the entrance, it only takes about like 2 to 3 days for you to kind of see the desensitizing effects. So basically, if we put it into perspective, right, the reason why Sensodyne calls this the rapid relief, quote unquote rapid relief, because it is faster than their other products, which use potassium nitrate, which is a lot slower in desensitizing the teeth, right? So overall, it is accurate that they call this a rapid relieving toothpaste. I guess the last thing I just want to touch upon for this toothpaste is basically what to kind of watch out for. The only thing I want to point out is that, which you may not find important, but it is very important to some people, is that it can increase teeth staining. Okay. Yes, you heard that right. It could potentially increase teeth staining. So here I have the box label for you, okay? If you look really closely on the other information on here, okay, I'll read it to you. Products containing stannous fluoride may produce surface staining of the teeth. Adequate tooth brushing may prevent these stains, which are not harmful or permanent and may be removed by your dentist, right? But it also says this product is specially formulated to help prevent staining. Overall, toothpastes with stannous fluoride can potentially stain your teeth. It is a FDA warning label, and they have to include it on all products which contain it. All right, most people kind of miss this section there. With that being said, I don't see the staining with all of my patients. Just that for some people, they do end up with more staining. And if that is the case for you, you may not want to use the Rapid Relief toothpaste. The other toothpastes which work slower, like the Pronamel toothpastes, which use potassium nitrate, it does not have that warning label on there. Okay, so that's just something to keep in mind. If teeth whitening or teeth staining is a big concern for you, you may want to avoid this one just in case. But you could just test it out and see if you actually get additional staining. If you don't, then just continue using it. All right? Absolutely nothing wrong with that. And that's the end of the Sensodyne Rapid Relief toothpaste review.